My name is Dieter Schöper. I'm Chair for Endocrinology and Diabetology at Ruhr University Bochum and Director of the Diabetes Centre here at Heart and Diabetes Centre North Rhine-Westphalia in Bad Oeynhausen. Patients with diabetes mellitus, a worldwide growing epidemic, are frequently and concomitantly affected by serious heart diseases. Diabetic heart disease is a composite of atherosclerotic coronary artery disease, heart failure, and electric instability. These result from glucose-driven glycation of functional proteins, furthering endothelial dysfunction, cardiac stiffening, and reduced myocyte energy generation. In turn, comorbid diabetes is frequently detected in patients otherwise treated for these cardiac diseases. The Heart and Diabetes Centre North Rhine-Westphalia is a model institution addressing both sides, providing optimized metabolic treatment, a holistic diagnostic approach, and definite treatment option for the whole spectrum of cardiac manifestations, even when the heart terminally fails. Mrs. B, our patient, a 70-year-old woman, has a type 2 diabetes diagnosis since 1995 within the frame of a metabolic syndrome. Around 10 years after the initial diabetes diagnosis, coronary artery disease was detected and treated interventionally by intracoronary stenting. Based on clinical symptoms, rapid progress was stated by the diagnosis of three-vessel disease requiring repeat PTCA and successful re-stenting. However, further rapid progress of the global atherosclerotic three-vessel coronary artery disease could not be halted. Invasive re-evaluation finally resulted in fast-trained trials of further interventional treatment so that operative revascularization was indicated. Metabolically, lipid control was achieved by additional PCSK9 inhibitor therapy. Weight control improved under guideline-based addition of incretin treatment with concomitant fair glucose control. Mrs. B reports acceptable symptom control and is referred regularly for reassessment of her vascular and metabolic status.
My name is Volker Rudolph. I'm Director of the General and Interventional Cardiology Department at the Heart and Diabetes Centre North Rhine-Westphalia here in Bad Oeynhausen. The reason for heart failure and ischemic cardiomyopathy is a reduced perfusion of the coronaries and a reduced perfusion of the myocardium, which then leads to reduced cardiac output, which the patients notice as reduced exercise capacity and shortness of breath. As we have seen in our patient, there's a real close correlation between diabetes and the metabolic disorders, which not only lead to disturbances in the myocardial function, but also to atherosclerotic disease and in the end lead to heart failure.
I'm Philipp Sommer, the Director of the Clinic for Electrophysiology and Rhythmology here at the Heart and Diabetes Centre North Rhine-Westphalia, Bad Oeynhausen. There's a strong correlation between the presence of metabolic syndrome and the presence of atrial fibrillation. Some of the mediators are well known, such as obesity, chronic inflammation and other processes, and some of these links between these two entities are much less evaluated. We know that controlling metabolic syndrome, reducing the weight of the patients, improving the blood glucose levels of diabetes patients can positively influence the outcome after treatment of atrial fibrillation, for example by ablation or also drug treatment. And therefore, by preventing atrial fibrillation, we could also prevent development of heart failure.
My name is Jan Gummert and I'm the Director of the Surgical Program in the Heart and Diabetes Centre. Patients with diabetes are at risk to develop severe cardiomyopathy, either with coronary artery disease or without coronary artery disease. And if the patients develop terminal heart failure, we have still options to help them, either with a heart transplantation or with a total artificial heart or ventricular assist devices. So the important message is, even if you have a diabetes, you can get a heart transplantation or a ventricular assist device.
Current research at the Diabetes Centre of the HDZ focuses on metabolic imprints on heart failure development. Our results support the hypothesis that reactive metabolites from glucose metabolism induce metabolic stress by lowering the energy production via central metabolic pathways, and furthermore, These highly reactive compounds trigger inflammatory and atherosclerotic processes. Reactive glucose metabolites are causative for loss of myocardial integrity and functionality in terms of cardiac fibrosis. Early reduction of glycemic stress is therefore, from the research point of view, an urgently needed concept.
We agree that patients with diabetes very frequently are affected by various heart diseases at various stages, and appropriate therapy makes it necessary to consult each other, which in the course of the disease requires the cardiologist in earlier stages and the cardiac surgeons and the terminal situation.
Absolutely, and I mean these patients are usually the sickest patients who carry the highest risk, and therefore you need experts to treat every aspect of their disease, and therefore close cooperations are essential.
And for me, it's very important that cardiac surgery can be done in patients with diabetes, especially heart transplantation, ventricular assist devices. But we need the help of the medical disciplines to control those patients, to reduce the risk of cardiac surgery.